Hi, folks. Welcome to a special Cape. And today, joining me and Heather are three very special guests. We're talking about pool testing going on in Gloucester schools right now, specifically the high school and O'Malley. We are with Jeff Parco. He is the head nurse for Gloucester Public Schools, along with Jess Trotsky and Kiley Davis, and they are pool testing admins. Welcome to the show, folks. Kiley, right off the top, you wanted to convey some messages to try to get some more students involved in the testing.
Yeah, so the success of pool testing, or weekly testing as we also call it, is all based on participation. So the more students and staff that participate, the better outcome we're going to have in results. So Jess is going to give just a quick explanation of what pool/weekly testing is and how it works.
So the hope with weekly COVID testing is that we're able to catch asymptomatic or pre-symptomatic students and teachers who may be infected with COVID-19. The hope is to keep our schools and our community safe. With doing the weekly testing, it's part of, an overall toolbox of approaches, including PPE and social distancing and the weekly testing, again, to help keep our schools and community safe. So how it works is a student or a teacher checks in with us. They blow their nose, hand sanitize, and then they do a little anterior nasal swab 3 times around each side of their nose. It's non-invasive, and it can be a very effective strategy to keeping us safe. The results are sent to Broad Institute in Cambridge. They run the test for us. It's a PCR test. And then the results are typically back within 24 hours. From there, the group of tests are either positive or they're negative. If the group is negative, there's no more notification of families or any further things you need to do. Your student can return to class as normal. If the group comes back positive, the members of that positive group will report down to the nurse's office with us, and we will do a Bionex rapid reflex test with the students or teachers. And that result is actually back within 15 minutes. So we're able to identify the positive individual in that weekly testing group, and then have them self-isolate and quarantine in guidance with the CDC guidelines that we follow.
Very nice.
So Jess, can I just ask, how large is a group? As I understand it, it just takes one person to be positive in that group. It's not as if the whole group are positive, right?
Yeah, great question, Heather. So the group is between 2 and 10 people in each individual group. If one person in that group has positive for COVID-19, that will cause the whole group to be identified as a positive group. And then that one person will then be identified with the rapid reflex testing that we do the following day.
So it's really just a much more organized way of testing the larger population in these little groups, right?
Yeah, exactly. It's much more cost effective and it's more streamlined too, to just do a pool testing or a group testing and then identify the positive individual.
And it doesn't hurt.
It doesn't hurt at all, no.
Jeff, I want to know what have been some of the biggest challenges that you've had to face in doing this, and why is it so difficult to convince some of the students to participate?
So there are some reservations for people that think that if they're in a positive pool, they'll need to quarantine the night before, or they may have an impact on their sports or academics, missing time of school. But it's important to remember that unless you are the positive person in that pool, your lifestyle and your academics and sports will not be impacted. So it's a great way to make sure on a weekly basis that we don't have asymptomatic spreaders within the building. So far, we've had a very good turnout with the outcomes. We've had 2 positive pools to date out of, I want to say, nearly 100 pools. So we are doing very well with identifying them and quick responses to that. So it's an excellent tool to help us remain open and to keep everyone in the school and in their sports teams to make sure that they're able to thrive and succeed.
And Kiley, can you speak to the accuracy of the tests?
Like any testing, of course, there's always a very small percentage of a false positive or a false negative. Thus far in our testing that we have done, we have not experienced a false positive at all. I think what a lot of students are afraid of is that someone in their pool will give a false positive in that pool test, and then that means that they are associated with that pool and have to behave as if they're positive. And that's just not the case. The kids are tested almost the next day, with the rapid testing. and they don't have to quarantine. They can continue to go about their life as normal unless they have symptoms, which, at this point in society, if you have symptoms of COVID-19, it's kind of, encouraged to self-isolate anyway. So it's really no change in their day-to-day life, other than we're asking them to step outside of their classroom for less than 2 minutes, do a low, shallow nasal swab, and then they pop back into class. It's really an easy, quick way for us to sort of stop the spread before it gets to the point where it's spread, amongst their small cohorts or their sports teams or, their families and communities at home, particularly with asymptomatic carriers.
Can you talk a little bit about the level of comfort this testing provides for the whole community?
It should provide a lot of comfort. There are very few opportunities for people to test regularly and for free. If you wanted to do that, you'd have to drive to one of the Stop the Spread sites, wait in line and test, and then wait for your results. With this, we're bringing the testing to your children, and they literally just walk out of class. It's so easy. It's not invasive. And then they're able to take that test result and say, hey, I got a test on Monday. I found out my results Tuesday. I'm negative. I'm going to test again next week. And, let's continue to remain negative if we can. But the real positive side is if you are positive and you are carrying it and you don't know, we're going to find out. And then you're able to stop it there. That's when you start, following the CDC guidelines for self-isolation and quarantining. But again, it's not happening unless you are the positive person in the weekly testing. So it's a great way to test for free, to test quickly, and to test at a site you're already at anyway.
Great point. So, and I also want to ask Jeff and Jessica, organizing all of this, what has that entailed, and who have you been working with? I'm assuming Karen, Carol, and Safathi and Ben, and et cetera, et cetera. Just want to give some name drops here and figure out how this process came about for such a huge task.
Yeah, you are correct. We have been working with the superintendent, Ben, the mayor, Karen Carroll, the director of the Department of Public Health. But this came as an initiative from the state to help people open the schools for the first time, or in our case, remain open to identify the asymptomatic carriers. So when the state had offered to cover the financial cost of 6 weeks of testing, that got us through the beginning of April. Recently, they have updated the guidelines and they will be covering us financially until April 18th. So that's great news. We get 8 weeks of state-funded testing. That's why we want to get all these people registered and ready to get tested. The more people that we get enrolled is the more effective this program is going to work. Without participation, it's a fruitless effort. So right now we have roughly 20% at the high school and 20 to 25% participation at O'Malley. My goal is to get those numbers up to 60 to 80% between the staff and student population. So without your help in getting everyone enrolled, we can't do this. So in short, it's a state-led program that has been initiated by the superintendent, myself, and my wonderful team of admins for the pool testing, being Jess and Kiley. And of course, the rapid reflex testing and other portions of this are falling on my excellent team of nurses. So I need to give kudos to them as well.
And it sounds as if it's just so important to be reaching the parents of these kids too, right? That's where the messaging really has to happen. Like, you need to get in there and get your test, right?
Anytime you use a new program, such as the database platform that we have, Project Beacon, there will be frustrations with registration and bumps along the way. The short explanation of the process is that you follow the link, you go through the demographics, they will send you a confirmation email, you recheck your email, hit confirm, and then you're all set. There's no need to register for an appointment. If you are registered in Project Beacon, your child or staff member will be eligible for pool testing. So that's the last step. It's a stress-free way to get weekly testing to bring a little bit of comfort to your student, your home, and your community.
Now, if people want to learn more about this or contact any of you, how can they go about doing that?
The best way to contact us is to email myself or Jess. We'll get back to you as soon as possible. So our emails are kdavis@gloucesterschools.com and jtrotsky@gloucesterschools.com. And we're happy to answer any questions or chat with any parents or any students who have questions about the process, questions about what they have to do if they're part of a positive pool, or anything, any reassurance that they need to understand that this program is safe, it's effective, and it's backed by a laboratory in Boston that does the test results for us. So we really can't get any more streamlined or accurate at this point in time, testing a large group of people in a safe and affordable way.
Parents can also log on to beacontesting.com if they have any other questions or want to explore the Beacon testing site or learn more about group testing through them as well.
Corey, I somehow left out that Beauport Ambulance are some of our most key players in this launch of the program. Beauport Ambulance, I forgot to plug, and they are providing 6 daily testers and an admin for them. So that's 7 people that are essential that I totally forgot to mention earlier.
Okay, Jeff Parco, Kiley Davis, Jessica Trotsky, thanks so much for your time. Thanks for your efforts. We really appreciate what you're doing. And we would love to follow up with you again in a month or two before school's out to see how things have progressed.